It's horrendous. As the UN and the non-governmental organizations, the NGOs, move into more remote locations where we've had problems accessing in the past, and now we are able to go thanks to negotiations with local leaders. We're finding actually horrendous situations. We've issued an alert for a community called Mbaru in North Darfur about 2 weeks ago, where thanks to the work of the local responders and UNICEF, we found malnutrition rates of 54%. And what that means is this is 3 times higher than the standard emergency levels. I've actually never seen anything like this. These are people mostly who've come from Al Fasher, given the violence there in October, that have moved into these communities. So this is children who are affected, and children experiencing that situation, which is a product of malnutrition, disease, lack of vaccinations, and the violence. We can expect death within days, for sure, weeks. So we are witnessing horrendous situations, and we are doing more assessments this week, and we expect to find something similar. So it's frankly, it's quite devastating to see this in the communities. Yeah, we've had a UN team in there twice, actually, in the past 2 weeks. Now, understand that Al Fasher was under siege for more than 500 days. So we're dealing with the situation where much of the town is destroyed, but also quite concerning is the presence of mines, so the contamination, given the heavy shelling there. So we are going in. We've been in the past couple of days, but we're limiting our movements to a certain part of the town where we can drive on paved roads. We don't want to drive over anything we can't see. Focusing on the hospital, the Saudi hospital, the people who've been displaced, and markets to understand what's going on, and delivering supplies. There's a particular concern about water, so delivering aqua tabs, chlorine to clean the water, health supplies, and in particular supplies for children who are malnourished, so nutritious supplies. We're also very concerned not just about the people there who are displaced from one part of the town to another, but the children who appear to be unaccompanied, meaning we don't know where their family is. So we are moving in, and we're also quite devastated by what we find there. And there are people there, not hundreds of thousands, but definitely people who are in need of assistance, who are in need of protection. So we will continue to do that. Well, we have delivered some small supplies. And again, in that particular location, but also in other locations, water is absolutely critical because pumps have been destroyed because of the war. So people are not able to access clean water. And remember, 2025, one of the biggest challenges we faced, and certainly the Sudanese people, was cholera. The cholera outbreak, which comes from lack of access to clean water. So if you don't have separate your toilets and your drinking water, then you have a problem, which is called cholera. And so we're really concerned about disease. And also remember that because that city was under siege for 500 days, and Darfur in general has been a place of intense fighting, the vaccination of children. So we have this combined lack of access to clean water, lack of vaccinations, and I'm very pleased that the vaccination campaign began last week in Darfur, thanks to the support of Ministry of Health of Port Sudan, but UNICEF and World Health Organization and others. So I wish I could tell you that there was one thing we needed, but it's just not one thing. It's a whole bunch of things put together, which are creating a really combustible situation here.